It's like we're standing on the edge of something huge, Like the whole world's about to change with this generative AI thing,
Hmm.
especially in healthcare. We're really diving deep. For this one, got reports from Forbes, the National Library of Medicine, even this Tech Target piece that breaks down like the top 12 ways AI is already shaking things up.
Yeah, and it's not just like futuristic speculation anymore. It's real world stuff impacting millions of people.
Okay, so let's unpack this a bit. AI as your personal health assistant, this idea really jumped out at me. Imagine, like, instant medical guidance, different languages, wherever you are.
And we're already seeing this, not just some far off possibility. Apps like Ada are out there, over 13 million people using it. You punch in your symptoms, the AI gives you potential diagnoses, even personalized advice.
Wow, think about someone who can't easily see a doctor. Maybe they live rurally, maybe cost is an issue. This is huge. Like a lifeline to getting the right info in their own language when they need it most.
Exactly. Bridging those gaps in access, giving people power through knowledge. That's what's exciting.
And it's not just the patient side either. Imagine being a doctor instead of feeling rushed in a 10-minute appointment. You've got AI there with you, taking notes, analyzing the patient's history, even suggesting questions you might not think of based on their specific case.
Right. And that's exactly what platforms like RhythmX are trying to do. Like, say a patient comes in complaining of fatigue. I mean, that's super common, right? But RhythmX, it's got their history, might suggest, hey, doc, ask about recent travel. Maybe it turns out to be some rare thing that wouldn't have even come up otherwise.
Like having a superpowered medical detective in the room. For the patient, that could be life-saving, a diagnosis they might have otherwise missed completely. And then it gets even wilder when we start talking about truly personalized treatment.
Oh, yeah. This is where generative AI could totally change the game, moving away from that one-size-fits-all approach to medicine towards treatments designed for your genes, your lifestyle, everything that makes you, you.
So instead of just treating the symptoms you've got, the AI could help us predict risks, prevent diseases before they even start. That's incredible.
Exactly. Going to the doctor and getting a health plan that's like as unique as your fingerprint, all because AI can crunch massive amounts of data, spot those patterns that humans would never catch.
Okay, but is this really possible? Or are we in science fiction territory here?
The truth is, it's already happening. Researchers are using AI right now, analyzing genomic data, finding those markers for things like Alzheimer's. We could be looking at targeted therapies that make these conditions a thing of the past.
So eradicating diseases that have plagued us for centuries, that's a big statement.
It is, but it's not impossible. And it's not just these huge diseases either. AI is being used to personalize cancer treatments as we speak, tailoring chemo to someone's specific tumor genetics, less side effects, better outcomes. That's the goal anyway.
It's like we're on the verge of this healthcare revolution. Everything's changing. But with all this talk about futuristic treatments and personalized medicine, are we missing something more basic? Like, what about all the paperwork, the insurance forms, the billing codes, all the stuff that makes healthcare such a pain?
I get it, might not sound as exciting as, curing cancer,
Well,
but trust me, AI can make a huge difference here too.
okay, I'm listening. How do you make healthcare administration exciting? That's a tough one.
It's not about making it exciting, it's about making it disappear. Think about AI handling all the boring stuff. Medical coding, billing, processing claims, all that's done behind the scenes. That's what makes healthcare so expensive.
So no more spending hours on the phone with the insurance company, no more surprise bills showing up months later, that kind of impact.
Exactly. And it's not just about saving money either. Imagine AI chatbots there for you 24/7, answering basic health questions, scheduling appointments, even helping you figure out your insurance benefits.
It'd be like having a virtual assistant who actually understands how all this healthcare stuff works.
Right. And as AI gets smarter, it can even give you personalized recommendations, like based on your medical history, your lifestyle, all that, here's what you should be doing to stay healthy.
So instead of just reacting when we get sick, AI is helping us stay healthy from the start.
That's the big idea, a proactive, preventative healthcare system. But of course, all this brings up questions about, well, the doctor-patient relationship.
Yeah, I mean, if AI is diagnosing, recommending treatments, even helping with surgery, what's the doctor's role in all this?
It's the big question everyone's asking. Are doctors going to be replaced? Or does AI just make them better at their jobs, freeing them up to focus on the things that make us human, empathy, communication, those tough ethical decisions?
Like we're standing at a crossroads here, incredible progress, but also these big unknowns.
That's technology for you. It forces us to adapt, to rethink, and ultimately figure out how this technology can best serve us.
This National Library of Medicine article, they talk about ambient intelligence. And I got to say, that sounds kind of creepy, right?
It does have a bit of a Black Mirror vibe to it.
Right. But then you dig in and it's like, wow, this could be huge.
Yeah, it's about making AI almost invisible, integrating it with sensors and stuff, so it's just part of the background of our lives.
Like sensors in your home, monitoring your health without you even thinking about it.
Exactly. So no more strapping on that fitness tracker just to see how you slept.
Oh, thank goodness for that.
Yeah.
But it's bigger than just convenience, right?
Oh, absolutely. Imagine, say, an elderly parent living alone. Ambient intelligence could be a game changer. It could monitor for falls, changes in how they walk, even subtle things like are their sleep patterns changing, all those little clues that something might be off, but without them having to lift a finger.
Like a silent guardian angel watching over them. Speaking of breakthroughs, what about medical imaging? AI seems to be everywhere these days, catching diseases earlier than ever thought possible.
Yeah, and it's not just about like small improvements. We're talking fundamental shifts in how things are diagnosed and treated. That National Library of Medicine article, they highlighted Microsoft's inner eye technology. Pretty fascinating stuff.
What's so special about it?
Well, imagine taking a CT scan, which, used to take experts hours to analyze. This AI can pinpoint the exact edges of a tumor in minutes.
Wow, that's incredible. What does that kind of speed mean for the patient?
Faster diagnoses, obviously, but also more targeted treatment plans. And when it comes to things like cancer, we know time is crucial. AI could be the difference between life and death.
It's like having a second set of expert eyes on your case, making sure nothing gets missed. And speaking of personalized treatment, let's talk about how AI could actually decode our DNA and create truly individual healthcare plans.
This is where things get really interesting. We're talking about moving beyond just treating symptoms and going straight to the source code of disease.
So, instead of just treating someone's high blood pressure, we could use AI to understand why they have it in the first place.
Precisely. We're talking about identifying the specific genes involved and developing therapies that target those genes directly.
So, no more one-size-fits-all medications. Everyone gets a treatment plan designed just for them.
Exactly. Imagine knowing you're predisposed to certain conditions, heart disease, diabetes, years, maybe even decades before they develop. That's the power of AI. It could give us the knowledge to make lifestyle changes today that could prevent serious illnesses tomorrow.
It's like having a crystal ball, but instead of predicting the future, it's helping us rewrite it.
Exactly. And the crazy thing is, this isn't just theoretical anymore. That article mentioned a study where they used AI to do real-time genomic profiling of brain tumors during surgery. Talk about cutting edge.
Wow, so surgeons are getting this critical information right there in the operating room.
Mhm.
That's incredible. But AI's reach extends beyond just genomics. It's
Yeah.
also set to revolutionize the way we discover and develop new drugs. Whenever I hear drug development, I think long, drawn-out processes, years of research, billions of dollars spent. Can AI really change that?
It already is. AI algorithms can sift through massive databases of molecular structures, identifying promising drug candidates much faster and more cheaply than traditional methods.
So we're talking about speeding up the process of finding new cures and treatments, even for diseases that have baffled us for centuries.
That's the hope. Imagine a future where developing a new antibiotic is as quick and efficient as a virus mutating. That's the kind of game-changing potential AI brings to the table.
It's mind-blowing, right?
Yeah.
Like something out of a movie, but it's really happening.
It really is, and it's happening now. The Forbes article even mentioned how they used AI to find new drug candidates for COVID.
Oh, wow, really? So that means we could respond to, future pandemics even faster.
Exactly. That's the potential. But it goes way beyond the big diseases everyone knows. Think about rare diseases, genetic disorders. Treatments for those are usually super expensive, take forever to develop.
Yeah, it's heartbreaking for those families.
AI could change that, make those treatments more affordable, get them to the people who need them faster. But okay, we've talked a lot about the really futuristic stuff. What about just going to the doctor? How can AI improve that experience for the average person?
Because honestly, even if there are amazing new treatments, dealing with the healthcare system can be a nightmare. Confusing bills, insurance problems, the whole 9 yards.
Yeah, definitely. And that's where AI can step in and smooth out the whole experience. One area they're looking at is revenue cycle management.
Okay, I got to be honest. When I saw that phrase in the research revenue cycle management, I was like, ugh, Sounds boring.
It does, but it's important. It's basically how the whole healthcare system runs, financially
Yeah.
speaking. And right now, it's a mess. It's clunky, it's slow, it's why healthcare is so expensive.
So you're saying AI could fix that?
That's the idea. AI can streamline everything, the billing, the coding, processing claims, all that behind the scenes stuff that drives us crazy.
So does that mean, like, no more arguing with the insurance company for hours on the phone, no more surprise bills?
That's the goal. And think about this AI-powered chatbots. They could be there 24/7, answering your basic questions, setting up appointments, even helping you figure out your insurance benefits. Wouldn't that be nice?
It would. It'd be like having your own personal healthcare assistant, someone who actually knows what they're doing.
Exactly. And as AI gets smarter, it can even start making personalized recommendations, looking at your history, your lifestyle, all that, and saying, okay, here's how you can stay healthy.
So instead of just reacting when we get sick, we're talking about AI actually helping us prevent illness in the first place.
Exactly. A proactive healthcare system. That's the dream. But of course, when you start talking about AI doing all this, it makes you wonder about the role of the doctor.
Yeah, if AI can diagnose you, recommend treatments, even assist with surgeries, what does that mean for the future of, like, being a doctor?
It's the big question, isn't it? Are doctors going to be replaced by robots? Or will AI just make them better at their jobs? Maybe it'll free them up to focus on the things that AI can't do, the human side of things, empathy, communication, making those really tough ethical decisions.
It's almost like we're standing on the edge of this new world. So much potential, but also, like you said, those big questions.
That's how it always is with new technology,
Yeah.
right? It forces us to adapt, to rethink things. Ultimately, it's up to us to decide how we want to use this technology to make things better.
And that's where our listeners come in. As you navigate your own healthcare journey, we want to hear from you. How do you see AI playing a role both now and in the future? This is a conversation that's only just beginning, and everyone has a part to play in shaping it.